Bowel cancer is preventable in 76% up to 90% by screening with colonoscopy only. So, colonoscopy for colorectal cancer, it is used for diagnosis and treatment of early cancer cases, and it could prevent 76 up to 90% of colorectal cancer. Of course, colonoscopy, it is one of the screening, but there are other methods of screening. For example, checking occult blood in the stool. Occult means hidden blood. And it is tested with a resin from plant on a piece of paper, and they have developer, which is the oxygen peroxide, and then it will be reacting with the heme or part of the hemoglobin of the human blood, and it will produce blue color. And this is called a Goya blood test or stool test. Yes. Now, colonoscopy, it has limitation because it might have side effect. For example, bleeding, infection, perforation, 1 in 1,000 cases. It depends where you do it, who is doing it for you, and how much it costs also. There is cost to it. In United States, it costs between $1,200 to $8,000, but the average is $2,500 USA dollars. The colonoscopy, the procedure, it is easier than the preparation. To clean the colon, it is more serious than to the procedure itself. Also, in United States, they advise 1 day of work and also another one to drive you to the hospital and to take you out of the hospital. But in my personal experience with colonoscopy, I went to the hospital alone, and then I came back in the train, in the underground and bus, not even by my car, because I opted to have the colonoscopy without any sedation. And I was watching the monitor with the surgeon to see my colon. So if you are brave enough, it could be done without any general anesthesia or sedation, if you know what is going on. So bowel cancer, by screening alone, we could reduce it by 76% to 90% because during colonoscopy, we will see polyps. Polyps is very important because they become malignant over time and with age. So it changes over the time scale. And also the location of the polyps. The other factors or other risk factors which affect bowel cancer could be divided into 2 major groups, which are the unmodifiable risk factor, meaning intrinsic risk factor, like age, old age. The older we become, the more we are liable to have colon cancer. And if you look to the graphs and the incidence of colon cancer or colorectal cancer, both colon cancer and rectal cancer, they increase after the age of 50 years, and that is in the United States. But my views about age is also different. And I would refer you to a video I have done, which is 24 minutes, about what is old age and what are the medical decisions in the elderly. Of course, old age, many people have written about old age, even in the time of the Roman Empire. For example, Cicero and Seneca, which is a Stoic philosopher. He was the teacher of Nero, the emperor. All these philosophers, they wrote about old age. And also in the recent times. What I believe is not the chronological age, which is the time from the event of birth to now. Time is important as a marker, but I believe, or not only me, is the scientists, they believe in the biological age. How the cell of the body function and the biology of the body. So the second unmodifiable factor is sex. The incidence of bowel cancer is higher in male than in females, but it is slightly higher. Number 3, race, ethnicity, and geographical areas. But if we look deeper, we will see what are the causes, and we could modify them also. For example, in the United States, the incidence of colon cancer and death or mortality from colon cancer is higher in Black African American. And they present themselves at a younger age group, meaning below the age of 50. The incidence of colorectal cancer in certain areas in Alaska, in the Alaskan Native, as well as in the American Indian, it is higher than the white population in the United States, the Hispanic, and the Asians. And why? The Alaskan Native and the American Indian have high, especially the Alaskan Native, because they eat high-fat diet, high animal protein, and high-fat animal fat. Also, it is fish and contain high omega-3, but still, the lifestyle, they smoke, they are inactive, they don't do exercises, they don't eat fibers in their food, they don't have vegetables, fruits, whole grain, it is very little. And also, they drink alcohol, tobacco smoking, they are obese, pre-diabetic, diabetic, they have high incidence of infection, for example, viral hepatitis and infection with Helicobacter pylori, which cause chronic gastritis in the stomach. The other factor, they are less screened by colonoscopy and other screening tests. So, for native Alaskan in the United States, they need more attention in screening and in modifying their lifestyle. In Alaska also, there are environmental factors which are called carcinogen, meaning cancer producing due to oil, gas, mine industry, which damage the ecosystem which is called tundra. And tundra is the geographical area in the Alaska and also in this area with the frost and the frozen, and it is a term from the Finnish people which is called tundura or tunturia, Tuntura. Tundra means it is a treeless plain which lies between the permanent ice of the far north and the northern frost of the northern America and now North Canada, Europe, northern Russia, and the Scandinavian countries. This treeless plain, it covers 20% of the Earth's surface, and although it appears cold and infertile for any life, but in fact, it is a biome. And biome means it is plants and animals which adapted to the environment in which they live. And it is an essential region that is loaded with diverse plants and animals, and it is important for making the biodiversity of the earth. So these Alaskan native, they eat a lot of protein and fat. Of course, high protein in the diet will stimulate a pathway inside the cells, inside the nucleus of the cells, which is called mTOR pathway. And this pathway, it is an intracellular signaling mechanism for cell cycle, cell growth, cell quiescence, cell proliferation, and cell cancer. And if you want to get more educated, I will refer you to a book which is called The China Study by Professor Thomas M. Campbell, C-A-M-P-E-L-L, Campbell, MD from America. He did the China Study and he examined the link between the consumption of animal products, meaning protein, fat, including dairy, milk, and the chronic diseases such as coronary heart disease, diabetes, breast cancer, prostate cancer, and bowel cancer. Of course, he was asked to study the high incidence of liver cancer in the Philippines in the children group. He did that study, and then he did also the China Study. And if you want to have more education about the influence of healthy lifestyle on diseases, chronic diseases, cancer, cardiovascular disease, they have the same etiology, which is the mutation in the genes and the environmental factor interacting with each other. And what is more important is not these factors, it is how they affect the pathways inside the cell and how they make the cell activity and how they change the activity of the cell. In tumors, the cell, when it become with changed gene, then it become out of order, out of balance. It divide rapidly, it evade immune system, it does not die, it become immortal cells. They can live forever. And they have the means to live forever by making a new blood vessel to give them nutrient and oxygen. So this is the problem with cancer. So I refer you to a book which is written by Dean Ornish in 1990, which is called Reversing Heart Disease. But fortunately, I discovered it in 1996 while I was attending a lecture about cardiac diseases in Auckland in New Zealand. And I bought the book while I was there for 14 in New Zealand dollars. But now the book price is about £5, some pences from the W.H. Smith. And on eBay, it is even less, £3, some pences. And why I know the price? Because this book, I give it to anybody who is willing to learn, who is willing to change his lifestyle. I don't give it to anybody, no, because some people, they don't. And it is up to them. They are free to choose. So I feel anybody who wants to switch the light on in his brain and change his life, and I have seen many lives changed by switching the light on in the brain about healthy lifestyle. And many patients, they lost weight, many patients are cured from diseases by this healthy lifestyle. And this Dean Ornish also, recently he also wrote a book, and he did a study on cases of a prostate cancer, low-grade cancer. They did biopsy, needle biopsy. They took tissue from the prostate and checked that these cases are cancer. And they are documented, they are recorded. And also, they did intensive lifestyle changes, and they noticed even within 3 months that the PSA, which is a prostatic specific antigen, which is a test we do for prostatic hypertrophy, meaning enlarged prostate in men, and in cancer. It is more important in cancer than in a prostatic hypertrophy, and the volume of the prostate is reduced. Also, they did the genomic, and they found that 48 good genes are upregulated and 453 genes are downregulated. And these genes are involved in a protein pathways in protein production. And protein, as we said, it is important for growth and important for cancer formation. Although protein is very important for repair of the cell, but we should not eat too much. And now they recommend 0.5 gram or 0.75 gram or 1 gram or 1.2 gram per kilogram of body weight. And it depends on the needs. If the woman is pregnant, if she is lactating, she is giving breast milk, if there is wound to heal, the intake should be increased. Of course, the protein stimulates the mTOR pathways, but fasting and intermittent fasting, it stimulates the other pathway, which is called AMPK. And what does it mean, AMPK? A means adenosine, P means it is related, AMP, it is a protein, and K is kinase. It is a protein-related enzyme. So, the body is a very complex biological system which is able to regenerate itself and rejuvenate itself. And every day, a healthy body will lose 1 million cells by dying every second. And during one day, 10 up to the power of 11, meaning you put 1 and in front of it 12 zeros, 1 trillion cells die in one day, 24 hours. Some people believe less than that, 50 billion or 70 billion cells per day, meaning a billion is 1,000 million. By clean death, which is programmed cell death, it is programmed in the gene of every cell, and it is called apoptosis. Apo in Latin means falling off. Falling off means it's just like the autumn leaf which fall off in the season of the autumn. Even nature is cyclical, and it is a rhythm. There is spring, when the leaves start to grow, and in the autumn they die. So there is a programmed cell death in the plant also to conserve the energy during the winter. No more growth. So the unmodifiable risk factor are age, sex, race, ethnicity, geographical area, medical diseases, for example, irritable bowel, inflammatory bowel disease, which is Crohn and ulcerative colitis. There is 70% increased risk in inflammatory bowel disease to have bowel cancer. But it happens not immediately. It happens after 10 years, 20 years, 30 years. After the beginning of IBD or inflammatory bowel disease, so it is related to the time and the chronicity of IBD. It is also related to the environment, for example, the radiation. There are 2% of bowel cancer cases in the UK in 2015 due to the exposure to radiation, either in treatment for cancer. So when they are treated with radiotherapy for cancer, the incidence is increased of the, so these are some of the non-modifiable risk factors. The modifiable risk factors are the food. Eating too little fibers in the food has caused around 30% of bowel cancer in the UK, 30 out of 100. Eating red meat and especially processed meat, sausages, hot dogs, bacon, beef, lambs, pork, caused 13% of bowel cancer in the UK in 2015. meaning 13 out of 100. The other modifiable risk factor is overweight, obesity. Bowel cancer increase by 11%, or 11% of the cases of bowel cancer in the UK are caused by obesity. Obesity and overweight, it is a cause of 13 other different types of cancer. So, to repeat, bowel cancer cases in the UK in 2015 caused by the overweight and obesity is 11%, 11 out of 100. So, to keep healthy body weight, healthy BMI, which is between 18 and 25, or between 18.5 and 25, is good, and it will reduce the risk of bowel cancer by 11%. And how to measure BMI? It is easy. Stand on the wall, put your back on the wall, and then put at the top of your head and measure how many centimeter. For example, you are 180 or 160, let us say. To make it as meter, you will say you are 1.6 meter in height. Multiply it again by 1.6, then you will get a figure, square meter. Then measure your weight in kilogram, divide your weight in kilogram on the square meter, and then you will get your body mass index. There are other means of measuring the obesity, like measuring the waistline at the biggest diameter around the belly button. But sometimes, and this is not a joke, this is a science, some people umbilicus or belly button, it is down because there is so much fat, it will become like a fold, like a skirt in front of their lower abdomen and in front of their thighs, hanging down to the level even of the knee joint. So in this case, the body girth or the body or the diameter is not. So you have to use other means of measuring the weight. And this is very important. Sometimes a skin fold, you pinch the skin and you see the thickness of the skin. How much is it? Sometimes they do the ratio between the waist and the hip. The biggest diameter on the waist on the biggest diameter of the hip. Or sometimes the height from the head to the umbilicus and the weight and the waist line. So there are many means of measuring your weight. And of course, one of the dangers of increased body weight is early death. I have a case, she was 180 kilogram and she came for an operation, which is, luckily, it was very small operation. It is called, in gynecology, it is called diagnostic curettage. She has heavy period. We know in gynecology, any woman who is obese, they are more liable for cancer of the lining of the womb or of the uterus, which is called endometrial carcinoma, breast cancer, high blood pressure. We know this. And we have seen many cases like this. So this case, I went to visit her preoperatively, and she could not sleep in the bed. She was sitting in the chair and sleeping, but she was gasping for air, snoring, moving in erratic movements. The color is molded with blue. She was cyanosed, meaning she does not have enough oxygenation. So they brought her to the operating theater. She does not fit on the operating table because the operating table was small. So we decided, and I decided to do her on the bed, on a patient bed which we brought from the recovery room because it is clean. And I kneeled on the floor, my knees were on the floor to do the curettage. And when I finished, 9 men in the operating theater to carry her body and to move her from this bed to the bed to transport her to the wards. When she came to the follow-up clinic, I told her this. I said, 9 men, they carry your body. So please, can you look after this point? She answered me. She said, it is their job and they are paid for it. I said, I am not discussing the young men who carried you. I'm discussing your weight. And she told me, have you been to United States? I said, yes, 8 times I have been to United States. And she told me, they are much more than me. So I answered, is it your model, the United States obesity? And that is how the people think. But after a few months, she went to Egypt to do liposuction, meaning to cut the fat from her body, and she died. And she was not old. I'm not blaming her. No. But she was divorced. She has 5 children. The husband doesn't allow her to see her children. She was alone and she was depressed. So she used to eat. But when I know her personally, when we are invited together, she doesn't eat. But the people with her told me she hid afterward and she started to eat 2, 3 chickens at one go. So this is the problem of obesity and overweight. It is serious. It is just like malignancy. It's not more. Then, exercise. The people who exercise regularly, more than 40% to 50%, they have lower risk of colon cancer compared to those who do not exercise regularly. So some evidence suggests that people who are active their entire lives have the lowest risk of colorectal cancer. The other modifiable risk factor is tobacco smoking. Tobacco smoking, 7% of bowel cancer cases in the UK are caused by smoking. The International Agency for Research on Cancer determined that colorectal cancer is a smoking-associated malignancy. It is associated with tobacco smoking. Why and how? Because the colon and the rectum may be exposed to numerous chemicals which are called carcinogens. Carcinogens means, carcino means carcinoma, carcinogens meaning forming cancer, chemical which form cancer. And this, in the tobacco smoke, they examine 50 or sometimes 60 of these carcinogens, and the toxic chemicals in the tobacco smoke, it vary between 350 and 1,000. And these chemicals, or cancers, they travel by the blood to other organs. So, for example, to the liver, to be detoxified, because the liver is the hub to clear the toxin, so you get liver cancer. In the kidney, because they would excrete it, so they will cause cancer of the kidney, of the bladder. So there is strong evidence to infer or to make a conclusion that there is a causal relationship between smoking and colorectal cancer and also liver cancer. Toxic smoking has causal relationship with cancer of the lung, larynx, oral cavity, meaning the mouth, the pharynx, the esophagus, the pancreas, the bladder, the kidney, the cervix, the stomach, and acute myeloid leukemia, which means cancer of the blood. This cancer, it affects the blood cells. So, smoking and addiction of smoking, which the patient use to ease their pains, I think, in childhood, it leads to the uptake of carcinogens to all body organs via the blood. Then, alcohol drinking. 6% of bowel cancer cases in the UK are caused by alcohol drinking. The association of alcohol drinking and colorectal cancer risk appear to be dose-related, meaning the amount of pure alcohol consumed and also the time, how long these people or these patients consume alcohol, how many years they consume alcohol. So it is related to time and to the dose, to the amount. So bowel cancer is 49% higher in people who consume the highest intake of alcohol during their lifetime. And all these figures are from meta-analysis. And meta-analysis means in statistics, the statistician, they put many clinical studies about one subject, and then they start to compare the data to produce a trend or pattern or a lesson from this meta-analysis and to come to a conclusion. It is more powerful than a single clinical study. And how much is a unit of alcohol? It is defined in the UK because unit of alcohol is different in different countries. Defined. It's not the same. It's not static. It's not one. But in UK, in the United Kingdom, it is defined as 10 milliliter, which is equal to 80 grams of a pure alcohol. And this definition, it is independent of the strength and of the amount of any individual alcoholic beverage. And this strength and amount, it is called percentage ABV. What is ABV? It means A, alcohol, B, by, V, volume. If we take an example of beer, which is typically from 3 to 13 per unit, percent ABV average or range. But the majority of beer is between 4 and 7% ABV range. So bowel adenoma, it is 27% higher in people who drank around 3 units of alcohol per day, and this association is limited to colon adenoma and not to rectal adenoma. So alcohol causes 7 types of cancer in 2015 in the UK, like mouth and upper throat in 25 to 30%, larynx, which is the box for at the top of your respiratory tract. If you have cancer in the larynx, you cannot breathe. Esophagus is for swallowing, 13%. Breast, liver, 7%. Breast, and bowel, which is 6%. So we talk about age, which is unmodifiable. But in my brain, I think it is modifiable. About sex, about race, ethnicity, and geographical area. And I think this is also modifiable. How? By the need for screening program, colonoscopy, stool test, tumor markers in the blood, intervention to reduce modifiable risk factor like smoking cessation, stop alcohol drinking, excess alcohol, changing behavior to reduce a risk for excessive weight, diabetes, prediabetes, overweight, obesity, diet, which is high in vegetables and high in fruits and low in protein, physical activity, exercise, stop drinking of sweetened beverages, which is high in sugar, and also to reduce the incidence of infection, viral hepatitis, or even HPV virus, which is a human papilloma virus, which during the recipient of anal sex, it increased the incidence of rectal carcinoma in younger age, and also mouth cancer in oral sex. And this human papilloma virus, there are many types, but the one which is pathological or pathogenic, meaning cause cancer, in the cervix of women. It is number 16 and 18. But there are many other viruses of HPV, which is 31, 32, 33, is many viruses. So also we could do modification of the environment. For example, human activities in oil, gas, mining, it reduce or it destroy the tundra. And what is tundra? It is a noun came from a French language which is called tunturia or tenturia or tentura, Tunturia. I spell things when I don't pronounce it, because even on YouTube there is no pronunciation for this word. It means a treeless plain. It's area which lie between the permanent ice of the far north. They are high up in the high North Pole, and the northern frost of the North America and northern Canada, northern Europe, meaning Russia, northern Russia, Scandinavian countries. This area, it covers about 20% of the Earth's surface. Although it appears cold and infertile for any life, but tundra is a biome. Biome means it is an essential region which is loaded with diverse plant and animals, which are living organisms, and they are on the ground, and they are important in making the biodiversity of the earth. It is just like the human microbiome in the gut, which are living in our gut, and they become commensal and friendly with us. And the more biodiverse our microbiota, the more we are healthy, and the less diseases we will have. So, I refer you to the book, which is called The China Study, and it shows how protein in animals, if you give them 5% in the mice, the cancer stop. If you give them 20% protein of their diet, the cancer start to be activated. And this is from my memory. If you want more incidents, so I refer you to the book by Dean Ornish, which is The Reversing Heart Disease. It is printed in 1990, but luckily I discovered it in 1996 when I was in Auckland, New Zealand, attending a lecture about cardiac diseases. And I bought it there while I was on holiday for 14 New Zealand dollar. But now it is cheaper in W.H. Smith. It is £5 something. It is less than £6. And on eBay, it is less than £4. And why I tell the prices, because I always buy it to give it as a present to friends whom I feel they want to change their lifestyle, whom I felt from the first talking with them, a light switch was on in their brain. And that is the aim of my all video talks, is to switch the light on in the brains. The talks or these videos is not to teach you information. No. There are so much information and you can learn. But the idea is to switch the light on as my brain was switched on after a stroke. And I asked myself, why do I have stroke at a young age? Why? And then I discovered stress in my case, and personality type A, perfections, and no human is perfect. And this is very bad. But all my life I have to be the first, and that is not good. So this Dean Ornish also recently, he did intensive lifestyle changes in the prostate and find a down regulation in the 453 genes involved in the protein and upregulation of good gene, which is about 48 genes. And they did the genomic study, and the pictures are on the books. Also now, family history, which is unmodifiable risk factor. And these are syndrome inherited if your parent have one gene. But one of them is called FAB, which is familial adenomatous polyposis, which involved in bowel cancer 1%. 30% of FAB, it is not due to the gene from one of your parents. No. This FAB, it happens when you are embryo inside the uterus of your mother, in 30% of cases. And then now, when you are born, you become a parent, you will transmit this mutant gene to your children and to your grandchildren. So, not all the genes are caused by hereditary. And not all the genes, when you have them, they will develop cancer. No. But we have to be careful with FAB. And also, there is another syndrome which is called hereditary non-polyposis colon cancer or colorectal cancer. It is acronym H hereditary, N non, P polyposis, CC colon cancer or colorectal cancer. And there is another syndrome. The incidence of HMPCC is 3 to 5% of cases of bowel cancer. There is another syndrome, MAP, which is in 1% of bowel cancer. It is, all these syndromes are rare. And there are so many. And it is just, what does it mean? It's very easy. MAP, it is a gene which is mutated from FAB. The FAB, the cause of the gene, or the gene which causes FAB, is called APC, adenomatous polyposis coli, meaning adenomatous gland, polyposis is polyp, which is a growth in the lumen of the gut or the large intestine, and polyposis mean many. So MAP is just a gene, APC, but changed. That's all. That's all. So the gene could change as they like. They are free. Because we said that tumor is very complex, any tumor, not only, because now we start to study the genomic. We study the pathways in the cell, how it functions, and how the function of every cell is affected. You see, FAB is an abnormal gene in every cell. So you could have a growth not only in the colon, you could have it anywhere. In the small intestine, in the stomach, anywhere. In the skin, in the bones, in the thyroid, in the abdomen, in the eyes, everywhere. Because the gene in every cell. So, the family history with bad gene predisposed to bowel cancer in 20 to 23% of cases. It doesn't mean that 20 to 23% are caused by the bad gene, but the family history with bad gene, which predispose, meaning you make you more at high risk. It does not mean if you have this bad gene, you will develop definitely CRC. No. And this is the duty of and the beauty of screening and modifiable risk factor of our lifestyle and the environmental factor like ionizing radiation, which cause 2% of bowel cancer in the UK, are limited or initiated by exposure or linked by exposure to radiation exposure. For example, if the patient with cancer is treated by radiotherapy, he will become more liable for developing a cancer. And also in the environment, like in Iraq, it's very high level of ionizing radiation by bombs and missiles, and the incidence of cancer in Iraq is very high, and so many types of cancer, and you cannot believe the types. It is not written even in the medical books. It is so common, it is so versatile, it is so diverse. You could not see cancers in the West like these cancers, because it is out of control, out of balance. So it is very rapid, it kills young people, so many. There is no border for cancer. So many doctors, professionals, scientists died with cancer in Iraq, and I know. So, the colorectal cancer, it is hereditary, meaning there is gene which predispose you, meaning more liable. It doesn't mean you definitely have it. Is in 20% of cases. FAP is 1%, H and PCC 3 to 5%, APC 113012, MAP 1%, Pis-Jagger syndrome, juvenile polyp, so many syndromes, and they are rare. So, to give an example, now we do differentiation between FAP and H and PCC. The prevalence, we said FAP is 1%, H and PCC up to 5%. Phenotype. What is phenotype? Phenotype, it is a set of observable characteristics of an individual resulting from the interaction of genes and the environment. So, in FAP, it is more than 100 polyps. So, if the surgeon see more than 100 polyps, he has to remove the colon, sometimes to remove the rectum. Because these patients, if you leave them, they will have thousands of polyps, thousands. So, in HNPCC, it is only few polyps. Okay. Genotypes, meaning what is the gene which causes the FAP? It is a gene which is called APC. APC, it is A from adenomatous, meaning gland, P, polyposis, C, coli, meaning colon. And the genotype, phenotype, we said it is a feature due to the interaction between the genes and the environment. But genotype, it means the genetic makeup of an organism. It describes the organism complete set of genes. In HNPCC, it is germline mutation. Germline means it's a line of genes. It's not one gene. It is a line, so many names for it. Of what a group, of what family, of what a tribe. The genes are a tribe, how they function. It is DNA, MMR gene. DNA, we know, it is the genetic material in our nucleus. It is double-strand helix. The backbone of the DNA is ribose sugar with 5 carbon atoms, to which is attached the phosphate group, to carbon 5. And the nitrogenous bases are toward the inside, in the middle, to make a step of the ladder. You remember, the DNA, it was ladder. On each side, there is a border of this ladder. The border is made of sugar, ribose, and phosphate. But inside is the step which is made of the nitrogenous bases, and they are paired. C, capital letter, paired with G. And the opening, now I say it correctly, it is to the right. And A, adenine, it is paired with thymine. And why we have another strand? This is nature. Because if the one strand is damaged or there is change, then we have a good copy to copy from it. That is the idea of having a double strand. Okay. When we want to copy the genes, of course, the genes are always made of 3 nitrogenous bases, and it is called genome or codon. And what are these genes for? They are for the amino acids. No more, no less. All these genes, all these blueprints to make the amino acid, which are the units for protein. And why protein is important? Because it is important to carry the function of the cell, of every cell, to build the structure of our body like bone, muscle, nerves, tissues. And also, it is important in function. It makes the enzymes, which make the chemical reaction in every cell rapid. It works as a transport to carry the oxygen, the carbon dioxide, the nutrient, the waste products, the cholesterol, triglyceride, antibodies are protein, antigen are protein. Okay. But also, in the body there are fat, which make the membrane of the cell, of every cell, and it is used for energy. It is a storage of energy for long term, for a long period of time, because each gram of fat will give 9 calories, and each gram of protein is 4 calories. But the protein usually is not stored in the body. No, it will be converted either into sugar or into fat. Why? Because the protein is used for repair, for function. And we don't need too much protein. Because if we take too much protein, then we will end up with more growth and more cancer. We need, it is variable. Some people, they say 0.5 gram, 0.75 gram, 1 gram, 1.2 grams of protein. Why? Because the body, for example, I buy a piece of salmon, which is wild, Pacific, pop eye salmon. 100 grams is £3.75. So I cut it into 4 pieces. Each piece is 25 grams. Every day I eat this amount as a drug or as medicine instead of taking omega-3 capsule or fish oil, because it is expensive. Each 25 grams, it costs me £1. And now the shop which they used to sell it, stopped selling it because not many people buy it. So we people, we determine the market. If more people buy this wild, it will be cheaper and we will be all healthier. So the protein we need 30 grams, and 180 grams, it comes from the recycling of a protein inside the cells. We said so many billions of cells are dead. Of course, these are recycled. The amino acids are used again to build up the body and to do protein. So perhaps the requirement every day is 210 grams. But 180, it comes from the recycling and 30 from our daily intake. So the genotypes and the germline mutation, which is called mean the mismatch repair genes. Mismatch, it is a process you see in the cell which repair the DNA if it is damaged or it is wrong. But if this gene doesn't work, then the cell will become with the mutant gene and will be liable to become cancer. The age of onset, in cases of FAB, it is 20 years or 25 years. And so they recommend screening for polyps every 1 to 3 years from the age of 12 to 14 years old. And in HNPCC, on average, the age is 44 years and over, so it is older, the patient is HNPCC. And the screen is every 2 to 3 years, less. In FAB, every 1 to 3 years, here 2 to 3 years, from the age of 25 or 35 years old. The localization of FAB, it is the left colon and the rectum, which is the descending colon and the sigmoid. But the other type of syndrome, it is the right colon, which is the proximal colon, it is the ascending colon. The associated disease location, in case of FAB, it is bone, eyes, skin, duodenum, thyroid gland, abdomen, which is called desmoid tumor. But in the other syndrome, it is the endometrium, which is the lining of the uterus, and sometimes it affects the stomach, the ovaries, the pancreas, the ureter, the renal, pelvis, and cystic duct. Why? Because these genes are in every cell. And this, if you think deeper, it is related to the embryology, how the baby developed inside the uterus, from what layer these organs has developed. You see, when we are babies inside our uterus, inside the uterus of the mom, there are 3 layers, germinal layers. We call them ectoderm in the outside, which make the skin and the nervous system, the mesoderm, which is the middle, make the muscles and bones, and the endoderm, which make the epithelium lining. So this structure, it could be due to this, the embryology, how the cell started and how the cells are similar in their origin, from which layer. So the diagnosis is family history, 60 to 70%, genes from one parent, but about 30% abnormal gene is produced at conception, and there is no family member with history of FAB. Then genetic testing, the gene is on chromosome 5, and this is by blood test, which could detect 80% only of people with FAB, not all of them. 20, we could not detect them. And it is not to detect the FAB gene, no. We have to detect the gene mutations, meaning the changes in the gene. This is the most important. It's not the gene itself, it is the changes in the gene. And medical conditions which are associated with colorectal cancer are diabetes type 2, as we said. The bowel cancer risk is increased by 20 to 30%. It is higher. Inflammatory bowel disease, bowel cancer risk is higher, 70% or higher in people with IBD or inflammatory bowel disease, and it is increased with time. And ulcerative colitis and Crohn, it depends on the extent of the disease. How big is it in the bowel? The duration, the time scale, and the location. Where is it? The patient who have IBD for 20 years or 10 years or 30 years or more have a 5% risk. The patient who have the IBD for 20 years or more have a 5% risk of developing bowel cancer. But in general, it is 70% higher. But if they have it more than 20 years, there is more risk, 5%. So it could be 75. So adenoma, around 1% of people with larger adenoma than 20 millimeter, meaning 20 is about 2 centimeter, is less than an inch. Or adenoma with high-grade dysplasia. Dysplasia means changes in the cell. When we examine the cell under the microscope, we see changes in the genetic material, in the shapes of the nuclei, and they develop bowel cancer within around 4 years of having their adenomatous polyp removed. Most bowel cancer develop from an adenomata or adenomatous polyp glands. By the age of 60, 1/3 of all population will have the risk of having at least one polyp. It takes long period, of course, for this polyp to develop into colon cancer or colorectal cancer. The risk of advanced bowel cancer is 80% higher in people with low-risk polyp detected during their first colonoscopy compared with those with no polyps detected at first colonoscopy. There is medication, aspirin. They think bowel cancer risk is 17% lower in people who use aspirin compared with non-user, but because we have to consider the risk of complication of aspirin, because aspirin, it could cause gastrointestinal bleeding. But if a patient, say, with HNPCC, if we want to reduce their risk, which is 5%, they could be advised for aspirin, but they need a close monitoring of a bleeding from the colon. Reproductive factors, the bowel cancer risk is 14 to 19% lower in ever user of oral contraception or birth pills versus never user of birth pills or oral contraceptive. Previous bowel cancer. If person have an bowel cancer, they will have a higher risk of developing another bowel cancer in the past. Why? Because of the genes and because it is interacting with the environment. So these people, they will have another cancer. Sometimes it is not necessarily colorectal cancer. It could be a cancer in other parts of the body. And could be due to the genes, to the environment, and could be due to the treatment of the first cancer. Because the treatment, radiotherapy, chemotherapy, it reduces the immune system. It depresses the immune system. So the cancer will happen. Gallstone, those people, the risk of rectal cancer is increased in people with gallstones compared to those without gallstones. And people with gallstones have double the risk of developing polyps in the large intestine, colon, compared to those without gall. And I think this is related to the bile acids secreted by the liver and is stored in the gallbladder, and it is important for the emulsification of fat inside the gut. And also acromegaly. Acromegaly means those people who have tumor in the pituitary gland, increase production of a growth factor or growth hormones, and which cause an overgrowth of bones, of extremities, of the face. And I have in all my life seen only one case, a woman, acromegaly, when I was registrar in Victoria General Hospital and Fort Park Maternity Hospital in Fife, Scotland, UK. This patient, she used to come to the clinic with bleeding, menstrual bleeding, for 4 years. And I looked to the file, she was given hormonal treatment. But once she entered the room, she looks huge. She is tall, she looked like a giant. So I asked her 3 questions. Number 1, do you have dentures? She said yes. Are they smaller? She said yes. Did you make a new one bigger? She said yes. Okay, this is number 1. Number 2, your shoe size, is it becoming bigger? She said yes. So your shoes, so your feet, you think it are bigger? She said yes. Okay. Would you please show me your hands? And their hands are huge. So immediately it clicked in my brain that this case is acromegaly. I went to my consultant and told him, look, there is a case of acromegaly coming with bleeding for the last 4 years. And of course, there is no improvement because the doctors, they look to the disease, the bleeding. They do not look to the patient. How come? I cannot believe it. Because she is a case, you cannot miss her. She is so tall, so huge, the skeleton is so big. And then I asked him, I told him, would you like to take her because you are a consultant? He said, no, you discover her, you deal with her. So I referred her to the Royal Infirmary of Edinburgh, and surely enough, she did have tumor in the pituitary, she did have brain operation, and the professor of neurosurgery sent me a letter. So this is my experience with acromegaly. And this is a lesson how to look to the patient as a whole, and not to look to the only to the disease, and to be narrow-minded and to be short-sighted. But most doctors are like this, because one professor in the exam, when I presented the case, he told me, I wish 50% will take history like you, but then he said 20%. And then he said, how many operations we have done for a wrong reason? Because the case in the exam was presented to have an operation, but by taking history and by examination, I did find nothing. So I asked her, please, my future is in your hand. I did not reach a diagnosis. I don't see anything wrong with you. And her story is completely different from the story she told the other doctors who are for 7 days doing the exam in final surgery in FRCS, and present them to Professor Keller, Keller, in the Royal Infirmary of Edinburgh. But when I examined her and took the history and went to see him, I presented the case. He asked me about the investigation, and I did. And then he told me the results, and then he asked me, what operation you want to do for the patient? I said, sir, this patient, she does not need operation. She needs to correct her economic, social status. And he asked, what do you mean? I said, this patient is 65 years old. She is shop assistant. She come at 5. Her landlord want to have a sex with her. She refuse. And she has a son who's taxi driver living in Edinburgh, not with her. And her husband is alcoholic. And his sister is a mental case in mental hospital. So when the husband come in the night to sleep beside her in the bed, she is frightened, she is anxious, she is worried, and then she get up in the morning and she is wetting the bed. So her condition is nocturia, meaning wetting the bed like children. It is not due to incontinence, meaning there is urination when she cough or laugh, what we call in medicine stress incontinence. No. And this case was admitted as stress incontinence for repair operation, vaginal operation, and she was presented for 7 days before me to the professor as such. And when I told him this story, he stood up and he said, I wish 50% will take such history. But then he said, this is too much. I wish 20%. Then he went to the sink and washed his hands. It is unconscious move to wash his hand from his guilt. And he commented how many operations we have done for wrong reason. And then he asked me, what do you like to drink? So I told him I want white coffee, sir. And the white coffee came and I drank it in the exam. So now, there are numbers which are in United States. In 2020, there will be about 53,200 of people in the USA will die this year, 2020, from colorectal cancer. Colorectal cancer is the second most common cause of cancer death in the United States of America if the men and women death is combined. But colorectal cancer is the third most common cause of cancer death in the USA in men. The first cancer is lung cancer, the second cancer is prostate cancer, the third cancer is colorectal cancer. In women in the United States, colorectal cancer, it is the third most common cause of death, of cancer death in women. After the first cancer is also lung cancer, the second is breast cancer, and the third is colorectal cancer. In United States, in 2020, there will be 18 million in new cases of cancer, not only rectal cancer and colon cancer, and more than 600,000 deaths because of cancer in general. And they expect in the United States there will be 1 in 2 will have cancer because of the Western lifestyle. Thank you very much.